Welcome to this patient audio guide about psoriatic arthritis treatment. This audio guide is produced by the nonprofit CreakyJoints and the Global Healthy Living Foundation and is made possible with support from AbbVie. Maybe you or someone you love suspects you could have psoriatic arthritis, or PSA for short, or perhaps you've been recently diagnosed with psoriatic arthritis, or maybe you've had PSA for a while, but you're experiencing new symptoms or are concerned that it's getting worse. This audio guide series can help you learn more about psoriatic arthritis and how it affects your health, so you can manage it better and start feeling better. Remember, this is not a substitute for professional medical care. Always talk to your doctor about issues concerning your health and medical condition. To learn more about what it's like to live with psoriatic arthritis and to hear from fellow patients like you, check out the Psoriatic Arthritis Club podcast, available wherever you listen to podcasts, or at psoriaticarthritisclub.org. In our audio guide on psoriatic arthritis symptoms, we explained that PSA is a chronic inflammatory disease that can affect your skin and joints. It can also cause other symptoms, such as inflammation, where tendons attach to bones, called enthesitis, swelling of your fingers and toes, called dactylitis, changes to the fingernails, such as pitting and thickening, and fatigue. Not everyone with PSA will experience all of these symptoms. The combination of symptoms that you have and how they affect you may help determine how your doctor approaches your psoriatic arthritis treatment plan. This audio guide will provide an overview of various treatment options for psoriatic arthritis, so you can be more informed when you talk with your doctor. But before we get into that, we need to spend some time explaining the importance of treating your psoriatic arthritis in the first place. Let's start by explaining what we mean when we say that PSA is inflammatory. This means that there is an abnormal response of your immune system. Your immune system is normally in charge of identifying germs and other foreign substances. But in PSA, the immune system starts attacking your own healthy tissues and cells, specifically the skin and the joints. Here's more on this from Dr. Eric Ruderman, a rheumatologist at Northwestern University.
If you have very active arthritis, it can cause damage to your joints, and that damage may be irreversible. And so the sooner you recognize what you have and start on some treatment that can control it, the less likely you are to have damage down the road because you've interrupted the process. So that's really critical. People who have really active disease are more likely to have heart disease. They're more likely to have strokes. They're more likely to have vascular disease because of all the systemic inflammation that they have. There are other illnesses that are seen in higher frequency with people with psoriatic arthritis, such as inflammatory bowel disease, like colitis, eye disease. So people with psoriatic arthritis get uveitis, which is an inflammatory problem in the eyes that needs to be managed, or it can affect your vision. The impact on your whole body by having the psoriatic arthritis is driven by the inflammation that's not just in the joints, but it's all through your body and can cause all these other problems. And by controlling it, you may reduce your risk for some of these other complications.
So, it's important to understand that PSA is driven by inflammation. And if your condition is not under good control, you could experience irreversible joint damage, which can impact your mobility and physical function. Though that may sound scary or overwhelming, on the other hand, it should be reassuring to know that an effective treatment plan can help prevent further damage to joints as well as treat the other symptoms of PSA. This may inform why your doctor is making certain treatment recommendations. Here's more on this from rheumatologist Dr. Grace Wright.
So the goal of treating psoriatic arthritis and, in fact, all inflammatory arthritis is to, number one, improve signs and symptoms. I want you to feel better, but I also want to stop what's happening on the inside, which is damage to the joint structures, right? So yes, we're going to look at getting rid of the stiffness and the swelling and the fatigue and the pain that you feel. But I also want to make sure that the bones are intact, that your joints are not being destroyed, so that 10, 15 years down the road, we're forced to do surgery to fix that joint because we didn't save it 10, 15 years earlier. So that's the one aspect. And then when we think about the skin, yes, we would love for everybody to have 100% clear skin. And we actually do have therapies now that for some patients are able to do that. Others will get 75% improvement, 90% improvement. But really we want to get you to the best possible place in terms of getting you back into your life. That's kind of my threshold. Can you get back into a life where you're not always thinking of, oh, my skin, oh, my joints, oh, my back, oh, I'm so tired, where you can now take your energies and do something with them, not just sort of have to bury all the symptoms that you're maintaining. And we now have some very effective therapies that can work really well for many patients.
You may be wondering, well, how would I know if I'm at risk for irreversible joint damage or other PSA complications? The answer is that your doctor monitors how your psoriatic arthritis is doing to make sure your symptoms are improving and to help prevent long-term damage. They may order blood tests to check for levels of inflammation or X-rays to look for signs of joint damage. Your doctor may assess your overall PSA symptoms by measuring something called minimal disease activity, which is a way to evaluate your psoriatic arthritis based on a number of different factors. It includes counting the number of tender and swollen joints you have, how much of your skin is affected by psoriasis, and how much enthesitis you have. Your doctor will ask you, as the patient, to evaluate your own pain, function, and assessment of how your disease is impacting your life. If your score is high in most of these areas, it could suggest that your disease is not well controlled. On the other hand, if your score is low in most of these areas, it could suggest that your disease is being well controlled and you would likely be feeling better. So now, let's spend some time discussing what PSA treatment options include. The focus of this audio guide is on explaining various medications, but it's important to note that a well-rounded treatment plan may also include physical or occupational therapy and healthy lifestyle changes, such as diet, exercise, and stress management. Dr. Ruderman told us that he thinks about medications in two broad categories: those that only address symptoms like joint pain, and those that also address the underlying systemic inflammation process. In addition, some medications work better for certain symptoms and not others.
When I treat somebody, when I work with somebody to come up with a treatment plan for their psoriatic arthritis, there are some medications that just help them with their symptoms and don't really address the process.
Medications in this category include non-steroidal anti-inflammatory drugs, or NSAIDs for short, such as ibuprofen. They can be prescription or over-the-counter. These medications can help relieve joint pain and stiffness and reduce inflammation. Corticosteroids, including oral medications and joint injections, also fit into this bucket. They can help relieve symptoms like acute joint swelling and inflammation. They may be helpful during a disease flare-up, but they're not recommended for long-term use in PSA. There are also topical medications, like creams, that can be used for psoriasis. They help reduce skin inflammation caused by psoriasis plaques.
And then there are a variety of medications that we think of as systemically active medications that help address the process.
By process, Dr. Ruderman means the systemic inflammation that is driving PSA disease activity. There are many medications in this bucket. You may hear the term conventional disease-modifying anti-rheumatic drugs, or conventional DMARDs. These are medications often given orally that can help relieve joint pain and stiffness. Methotrexate is an example of a commonly prescribed DMARD for psoriatic arthritis. Another category is known as targeted synthetic disease-modifying anti-rheumatic drugs. These are oral pills that target specific parts of the immune system to help reduce inflammation. They can reduce joint pain and swelling and may help prevent long-term joint damage. These medications are often categorized as oral, small molecules, and include Janus kinase, or JAK inhibitor, and PDE4 inhibitors. They may sometimes be taken in combination with some conventional DMARDs. Another broad category is known as biologic disease-modifying anti-rheumatic drugs, or biologics. Given as injections or infusions, these medications act on specific parts of the immune system to help reduce inflammation. They can reduce joint pain and swelling and may help prevent long-term joint damage. There are many different kinds of biologics. They may sometimes be taken in combination with some conventional DMARDs. Which medications you and your doctor decide on will depend on many different factors. You and your doctor should discuss things like your current symptoms, your goals for treatment, how the medication is given, the potential side effects, your health history, and the severity of your psoriatic arthritis. Here's Dr. Wright on the importance of getting a treatment plan that is personalized for you.
So the right treatment for a patient treats the disease that they have. There are some patients that have very little skin, some that have very little swollen joints, some that it's on the axial, some for whom function is really bad because of the fatigue, but other than that, they're not so bad, right? So we have to think about these areas of minimal disease activity, all of the domains that we're checking here, but then apply that to that particular person. So yes, you want your treatment to address everything, understanding that it may not be one approach, one drug that treats this. It may be that your fatigue is improved by exercise plus your medications. You may need a topical plus your injectable or your oral, in addition to changes in diet in order to address this. But at the end of the day, I want you to have this holistic approach that addresses all of you when I manage your disease.
Dr. Ruderman explained that many patients have concerns over medication side effects. Each medication has its own set of potential side effects, or the benefit-risk profile. You should make sure to talk to your doctor about both when you're deciding on a treatment plan.
People are, appropriately and understandably concerned about risks and side effects with different medications that you talk about, with them, especially these days when they've seen commercials on TV and, they always have that list of things that could happen, some of which sound horrific. And, part of my job is to say, well, look, they have to tell you all those things, but the risks are pretty low, and here's the story. But then you also have to talk about the risks of not treating things, that the alternative to not having the risk of the medicine is not zero risk. It's the risk of having a disease that's not well treated, and what's that going to lead to? And so you have to sort of have that balance, and that becomes part of the discussion.
Another common question that comes up about treatment is, when will it start working? When can you expect to start feeling better?
So we can assess whether a medication or a treatment strategy works by measuring it, right? So we can look at the skin and say, is the skin improving? We know from all of the clinical trial data how quickly we expect them to work and how much we expect them to work. If I have you on a medicine that should work within 12 weeks and it's now 6 months and you're still struggling, it's clearly not working for you. But what we don't have is a magic solution where within 1 week you're better. And I think part of it is really setting expectations that it typically takes about 3 months for us to see, effect X, whether it's joints getting better, skin getting better. Nails, for instance, will take sometimes a year because nails grow slowly. It's really sort of understanding all of these areas that we talked about. They all have their own timelines, but we know for the different agents what those timelines are and can help guide you so that we can, level set the expectations appropriately.
You may hear other PSA patients talk about trying different medications in order to find one that works for them. Because psoriatic arthritis affects each person so differently, this trial and error can be a common part of your patient journey. Here's some perspective from rheumatologist Dr. Alexis Ogdie.
So sometimes patients do get really discouraged, particularly after they failed a couple of drugs, for example. And I shouldn't say that they failed the drug has failed them. So once the drug has failed you a couple times, it gets frustrating. But what I'd say is, hold hope, because there's many different therapies available. And sometimes it's not the first one or the second one. Sometimes it's the third one, but keep hanging in there, and we can generally find something that's going to make you feel better.
If you're listening to this and feel discouraged about how your PSA is doing, we want to end with this insight from Dr. Wright.
So the first thing I'd say if you're not doing well is that you can be better. You can be better. There are options that we have. There are things that we can do today that we couldn't do 5-10 years ago. And so find somebody who will listen to your voice. Find your own voice so that we can certainly start to approach you with a different set of options so that you can start to become re-engaged in your own life.
We hope this audio guide has provided helpful information about the types of medication treatment options available for psoriatic arthritis, the importance of treating inflammation to reduce the risk of irreversible joint damage, and control other symptoms, and why your doctor needs to know about all your PSA symptoms in order to help pick the right treatment approach for you. Psoriatic arthritis can be a complex condition to navigate, but remember that there are many effective ways to treat PSA, especially when you partner with your healthcare providers. You have what it takes to deal with this. We'd like to thank Dr. Ogdie, Dr. Ruderman, and Dr. Wright for their input and expertise. Keep listening to our audio guides for more about managing psoriatic arthritis. For more about what it's like to live with psoriatic arthritis, check out the Psoriatic Arthritis Club podcast, available wherever you listen to podcasts, or at psoriaticarthritisclub.org. This audio guide was made possible with support from AbbVie. And for more information about managing PSA and to join a free, worldwide support and advocacy community of PSA patients and their families, visit CreakyJoints.org, which is a part of the nonprofit Global Healthy Living Foundation.